Hi, I'm Carrie Lester. I'm the Executive Director of the Substance Awareness Center of Indian River County. So opioids are central nervous system depressants, which mean they slow down the central nervous system, they slow down brain activity. They are best known for their use in treating pain, alleviating pain. And so in the medical field, we hear of prescriptions called hydrocodone or oxycodone, Dilaudid or morphine are very strong opiates that are used to treat pain. On the streets, illicitly, we most commonly hear of heroin. More recently, we hear about now manufactured fentanyl. And it's important to note that whether they're prescribed by a doctor or used illicitly, that they all have the potential for addiction. And when misused, opiates can lead to overdose and death. And so if you are prescribed opiates, it's really important that those are under the care of a trained medical professional who's going to weigh the risk and benefits of those medications, that they are always safely stored and then disposed of when you're done using them. Stimulants are drugs that accelerate the central nervous system. So they're going to speed up the central nervous system and brain activity. So they're going to increase alertness and energy. Interestingly enough, they are used to treat attention deficit disorder. And so some of the prescription stimulants we hear of are amphetamines like Adderall or Ritalin. On the streets, we'll hear stimulants of cocaine or methamphetamine. And again, like the opiates, they have a high potential for addiction, and so when misused, they too can lead to overdose or death. The process of becoming addicted to opioids or stimulants is going to vary by each individual, but addiction is a brain disorder. It is an actual change in the structure and the function of parts of the brain, and so particularly we're looking at is the reward system. The reward system is that part of the brain that drives us to repeat behaviors that feel good, give us pleasure, or are life-sustaining, such as eating. And so when there are structural changes to the reward center that are caused by drugs like stimulants or opioids, at some point that person's behavior, that person's drive to use substances is no longer choice, it's actually biology. And like I said, that process is going to vary by each individual, but I can tell you it can happen relatively quickly with the use of opioids or stimulants. So the combination of opioids and stimulants together is often called speedballing. And as I said earlier, each of these class of drugs as a standalone is very dangerous to use and comes with an inherent risk for overdose or death. And when we combine the two together, we've increased the dangers and the risk of overdose. These drugs combined together are going to have a push-pull on the body systems, because one is a central nervous system stimulant, the other is a depressant. And that push-pull is going to cause an intense rush, but it's also going to have an intense taxing on our lungs, on our heart, and on our brain. The risk of respiratory failure is increased with the combination of these drugs. The opioids or the stimulants are going to wear off sooner than the opioids and lead us at risk for that respiratory failure. Both opioids and stimulants have a withdrawal syndrome that's associated. So when we think about an opioid withdrawal, we're thinking about the worst flu you could possibly imagine. We're thinking of severe body aches, chills, nausea, vomiting, restlessness, agitation. With stimulants, you'll also see an increased craving for stimulants. You're going to see a little bit of decline in cognitive function, some difficulty concentrating, depression, anxiety, and mood swings. These discussions are so important because they reduce stigma. The fact is 93,000 Americans lost their lives to overdose last year. And so no one really is immune. I think if we all look within our circles, someone's been affected. We need to reduce stigma. We need to help educate so people understand about brain disease. And we should talk about evidence-based access and educate to evidence-based treatment. We should talk about evidence-based policies to make sure that people have access to the care that they need. You can be supportive of a loved one first by educating yourself, start to learn and understand about addiction, about brain disease, and you should seek support for yourself, whether it's with a professional, a trusted professional, a support system. It's really important that that support help you set healthy boundaries, communicate clearly with your loved one, and perhaps help you engage your loved one into treatment and recovery. If your loved one is in treatment or recovery or in a treatment program, become involved. Become involved in any of the family programming that Recovery Center offers. And maybe take a look at your own substance use, inventory your own substance use. If there is substance use that needs to be addressed, take a look at that for yourself. And never use substances, including alcohol, in front of a loved one who is trying to recover.